I became fascinated how the sport of baseball had embraced Moneyball, this idea that players were all different. In the same way that no one's ever trying to miss a baseball, I also knew that no one was ever trying to hurt patients. And yet statistically, there are wide variations in the care, the cost, the quality that we deliver to our patients. And so we began to wonder, could we bring a data-driven approach to understanding what physicians were good at doing and match them up, put them up to bat in situations where they knew that they would do well and deliver the best kind of care to patients.
At the core of what we do is really making sure that patients get to the right providers at the right time.
The very first part of our platform that we developed was the canonical database that describes every provider in the country, what they do, what they see for, what demographic information describes their practice.
And so what you help to do is to aggregate all of that information into a single platform, to allow that to be searched, to allow all those different features to be met, and make sure patients are getting to the right provider the first time.
By defining what it is doctors and providers do, we can really build the operating system for hospitals.
We believe that this is the next big category in healthcare IT that will really take everything that's being done with the healthcare reform law and truly make it actionable in the context of hospital systems. And so we are very excited about the massive opportunity that we're going after.
One of the fun things about building a company that's never existed before is that you actually have to create new kinds of people. There were not healthcare data scientists 5 years ago when we started.
From a candidate perspective, we look for folks with data expertise, with technology expertise, with clinical expertise, with a lot of business acumen.
I love that the leadership at Kyruus is really paying attention to what people are really good at and putting them in roles that they are going to really enjoy and be challenged by.
The level of talent here, the accessibility of folks around here is just unparalleled.
Anything you want to do, anything you want to learn, whether it's something on the business side, in marketing, in technology, there's someone that you can go to and ask them about it.
People are passionate here. They love what they're doing and they're willing to do whatever it takes to make our product successful.
I'm working on unifying authentication, authorization, and user management across all of our applications.
Right now I'm working on a new way of processing addresses in one of our APIs.
I'm working on creating a dashboard that shows supply and demand for medical conditions for our clients.
We do still keep that casual atmosphere. We're a very open culture.
It's collaborative when you want it to be, independent when you need it to be. You're very much trusted to do your best work and do your own work.
As a healthcare company, our founders are really focused on making sure that we are a healthy team.
We get things like standing desks.
We've got a view of the harbor. It's absolutely beautiful.
I don't think we could have built Kyruus in a better place than Boston.
Boston is really an epicenter of clinical medicine. The hospitals in Boston are really unbelievable.
I think one of the unique characteristics of Boston is that people here want to work on real problems. As inefficient as healthcare can be sometimes, I think what drives all of us is the impact that it has on people's lives.
Everybody here wants to make a difference. Everybody here has some kind of stake in healthcare. Everyone's either been a patient, had a family member who has had some awful experience that they really want to see change.
Not only are we helping the health system's business, but we're having a real impact on patients' ability to get well and get through their clinical needs.
Being able to use technology and engineering to solve a real-world problem is exciting.
The issue of patient access has been something I've always been interested in, and Kyruus gave me the opportunity to really work on this issue at a really high level.
At Kyruus, we're really helping to make those technical challenges disappear for some of these hospitals.
Improving doctors' and patients' lives at the same time is something that really inspires me.